Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on innate versus adaptive immunity, with 4 answer choices and explanations. Here, Immunology. Clinical vignettes. 1. Innate versus adaptive immunity. Key differences. A 5-year-old girl presents with a sore throat and fever. Her immune system rapidly responds within hours using neutrophils, macrophages, and complement proteins. Which type of immunity is primarily responsible? A. Innate immunity. B. Adaptive immunity. C. Humoral immunity. D. Cell-mediated immunity. Answer A. Innate immunity. Explanation: the innate immune system provides a rapid, nonspecific response using phagocytes, neutrophils, macrophages, complement proteins, and natural killer NK cells. Adaptive immunity is delayed but highly specific. HER2. Adaptive immunity. Memory response: a 15-year-old boy receives the MMR vaccine. 3 months later, he is exposed to measles but does not develop the disease. What mechanism explains this protection? A. Neutrophil activation. B. Complement activation. C. Memory B and T cells. D. Macrophage phagocytosis. Answer C. Memory B and T cells. Explanation: vaccination stimulates adaptive immunity, leading to memory B and T cells, which mount a rapid and strong response upon re-exposure. 3. Complement activation. Innate immunity. A 68-year-old man with recurrent Neisseria infections is found to have a C5c9 MAC complex deficiency. Which immune pathway is affected? A. Classical complement pathway. B. Alternative complement pathway. C. Lectin complement pathway. D. All complement pathways. Answer: all complement pathways. Explanation: the membrane attack complex, C5c9, forms pores in bacterial membranes and is activated by all complement pathways. Deficiency leads to increased susceptibility to Neisseria infections. For toll-like receptors, innate immunity activation. A 35-year-old woman with sepsis has high levels of TNF-α and IL-1. Which component of the immune system activated this response? A. T-cell receptor. B. B-cell receptor. C. Toll-like receptors, TLRs. D. Antigen-presenting cells. Answer C. Toll-like receptors, TLRs. Explanation: TLRs recognize pathogen-associated molecular patterns, such as LPS gram-negative bacteria, leading to cytokine release, e.g. TNF-1 in sepsis. 5. Natural killer NK cells. Innate immune response? A 55-year-old man with chronic viral infections has a defect in cells that kill virus-infected cells without MHC restriction. Which immune cells are deficient? A. CD4 plus T cells. B. CD8 plus T cells. C. B cells. D. Natural killer NK cells. Answer D. Natural killer NK cells. Explanation: NK cells are part of the innate immune system, killing virus-infected and tumor cells via perforin and granzyme, independent of MHC recognition. 6. Dendritic cells, linking innate and adaptive immunity. A 29-year-old woman has a bacterial skin infection. Which immune cells act as the bridge between innate and adaptive immunity by presenting antigens to T cells? A. Neutrophils. B. Macrophages. C. Dendritic cells. D. Natural killer NK cells. Answer C. Explanation: dendritic cells are professional antigen-presenting cells, APC, that capture antigens, migrate to lymph nodes, and activate T cells. 7. Humoral versus cell-mediated immunity. A 24-year-old woman with X-linked agammaglobulinemia disease has recurrent bacterial infections, but is resistant to viral infections. Which immune function is impaired? A. T-cell activation. B. Phagocytosis. C. B-cell antibody production. D. Complement activation. Answer C. B-cell antibody production. Explanation: Bruton's disease, XLA, is a B-cell disorder leading to low immunoglobulin levels and recurrent bacterial infections. T-cell function, cell-mediated immunity, remains intact, providing viral defense. 8. CD4 plus versus CD8 plus T-cell functions. A 40-year-old woman with HIV/AIDS has a CD4 plus T-cell count of 100 cells per megalila. She is at high risk for which type of infection? A. Extracellular bacterial infections. B. Intracellular viral and fungal infections. C. Neutropenic infections. D. Autoimmune diseases. Answer B. Intracellular viral and fungal infections. Explanation: CD4 plus T cells coordinate immune responses, especially against intracellular pathogens, e.g. Mycobacterium pneumocystis CMV. Severe CD4 plus loss in AIDS leads to opportunistic infections. Passive versus active immunity. A 32-year-old man with a dog bite receives rabies immune globulin. How does this form of immunity work? A. Active, long-lasting immunity. Passive, short-term immunity. C. Innate immunity activation. D. T-cell mediated response. Answer B. Passive, short-term immunity. Explanation: rabies immune globulin provides immediate short-term protection via preformed antibodies. Active immunity develops after vaccination. 10. Autoimmunity, loss of self-tolerance. A 28-year-old woman with systemic lupus erythematosus, SLE, presents with fatigue, joint pain, and a malar rash. Which immune mechanism is responsible? A. Loss of self-tolerance. B. Complement activation. C. Overactive innate immunity. D. T-cell deficiency. Answer: A. Loss of self-tolerance. Explanation: autoimmune diseases like SLE occur when self-tolerance mechanisms fail, leading to autoantibody production against nuclear antigens, e.g. anti-dsDNA, ANA. Key takeaways for innate versus adaptive immunity. Innate immunity equals immediate nonspecific, macrophages, neutrophils, complement, NK cells. Adaptive immunity, delayed, highly specific, memory-based, B cells, T cells. Dendritic cells link innate and adaptive immunity. Complement system defends against encapsulated bacteria. CD4 plus T cells regulate immunity. CD8 plus T cells kill infected cells. Passive immunity, e.g. rabies IG, is temporary, while active immunity, vaccines, is long-term. Autoimmune diseases result from loss of self-tolerance. Would you like vignettes